everyone, this is Dr. Jerisa ER, your board certified emergency medicine physician. I help confused, nervous, anxious patients in emergent conditions get back to baseline again. Today on the Tips for Your ER Trip, I am at a diagnostic center and I had to help a patient, a VIP patient who was getting a cardiac stress test today. And so because of that, I wanted to get on and kind of give you an idea of what goes on when someone is getting a heart or exercise stress test. So here is the treadmill. It really is essentially a treadmill. These are the leads that are placed on your chest. This is the monitor back here where your heart is continually monitored. When you arrive, we get a baseline EKG, and then during the process, we're monitoring your heart, and you're pretty much hooked up the entire time, so that way we're monitoring for any arrhythmias or any changes or even ischemic changes that are occurring while your heart rate is increasing. And that is the point of this. You're on the treadmill, as you can see here. While you're on the treadmill, the levels go up. So you'll start off with a mild kind of slow walk, and then it'll go up to a kind of more of a brisk walk, and then it will even increase to your almost jogging in a sense. And of course, while you're doing that, we're monitoring you. We're asking you if you're having any chest pain or if you're feeling any discomfort. We're also, of course, because you're on the monitor, we're able to see if there's anything abnormal that's going on with your heart. Who gets this stress test? And that's what I wanted to talk about. And after I've kind of showed you what it is, to give you an idea of what's going to happen when you get a stress test. Who gets it? So if you have chest pain and you have risk factors for heart disease, any of the risk factors, you're a smoker, you're diabetic, you have high cholesterol, you have a family history, even if you're young and you have a family history of heart disease, you should consider having a stress test. If you're not asked or offered it, request it. It is a complete, thorough workup of someone who has chest pain. Don't just stop at an EKG in the emergency room. To be thorough, it's important for you to go ahead and get the stress test. There's different types of stress tests. You can have an exercise stress test, which is what I was just showing you here. There's also some stress tests for patients that cannot tolerate exercise. And of course, older patients, patients who have extremity or hip, leg discomfort, or patients who have, lung disease who really can't tolerate the workout. And it essentially could be a workout on the treadmill. But, if you're otherwise younger, like some patients, even the patients that I had today was fairly young. So keep in mind, you do not have to be old with heart disease. If you are young, if you smoke, you're obese, you may be at risk for diabetes, and more importantly, you have a family history of heart disease, then definitely consider having a exercise stress test to complete your heart and cardiac workup to make sure that you really don't have heart disease. And certainly if you do have heart disease and you know it, things can be done to start the treatment for it. That's all I wanted to say and show you today and give you an idea of what the cardiac stress testing is about. I am Dr. Jerisa ER. Of course, you can follow me on all the social media. Until next time, I will see you guys. Have a great day. Bye.